So we're going to go slightly, well, I don't want to say easier. We've got some really good cases coming up. But like I said, some people have got varying levels of experience when it comes to these X-rays. So we just have a look at this one first. So I'm looking at we're having a look at this ankle, right? And on this view, it doesn't look like there's a huge amount going on. And so one of the things I would always do is have a look at that sort of talar dome and have a good look around, just make sure there's no osteochondral defect. And for those that don't know, an osteochondral defect is where you've got an osseous defect and you'll see something like this or something like this. It'll kind of look a bit radiolucent or anything like that. It will look kind of abnormal in that area. And there's gradings of osteochondral defect. And actually, generally speaking, the most likely place you'd get an osteochondral defect is going to be in the supramedial. So that's going to be medial because that's medial malleolus, supramedial talar dome. But this one doesn't seem to have anything like that. And actually, in truth, the next place I want to look at is the base of fifth, because so often you have a base of fifth fracture that you just won't see because you're looking at the ankle. And then again, have a look at everything else. Everything else looks okay. I haven't seen anything grossly abnormal. Some people might start to worry that that line there, can you see that, is some sort of fracture. But actually, when you look at the adjacent areas compared to that line, it looks very, very well sclerosed. So it's going to be most likely a vascular channel. So on this view, I mean, if you've seen it, great, well done. But we haven't, it's not entirely obvious until you go across to this other view over here. And when you go to this view and you zoom in, like so, and then pan across like this, you'll see that there is something slightly abnormal. So let's draw around. So this is going to be the tibia. We're coming around this way, and then the tibia does this, like this. And it feels like there's an abnormality maybe here around the back over here. But actually, more importantly, as well, we're going to come over here, and then you can see that there is radiolucency does this. And then you can keep drawing like this, and this goes all the way around like so, like so. So what I've essentially done is drawn a fibula, so lateral malleolar fracture, and I would be concerned there's also a posterior malleolar fracture as well. Then we should probably look and see whether this could be a trimalleolar fracture, where you've got medial, posterior, and lateral. But actually, I can't see a medial ankle fracture at all. So actually, everything else looks okay. And then you want to make sure that there is no calcaneal fracture as well. And the way to do that is have a look at the trabeculations, make sure that you can see the trabecular pattern going all the way along like this. And if there's any disturbance in that trabecular pattern, then you will be concerned about a calcaneal fracture. But there's no calcaneal fracture. We can pretty much say that, yeah, it's most likely a lateral malleolar fracture and a fracture through the posterior tibial plafond, with most likely some articular surface involvement as well. No other fractures at all on this one. And actually, if you come back to this one and you zoom in again, we thought it was normal. When you kind of look in retrospect, you can see there is something abnormal there, I suppose. But more importantly, if you go and look at your own ankles, unless they're swollen, generally speaking, your skin should really be right against there. Yeah, I mean, you could put your hand on your lateral malleolus and feel your bone straight under. And when you've got that level of sort of soft tissue thickening, you really got to start thinking there might be something up. There could be a ligamentous injury, or there could just be I mean, like we've seen on this particular occasion, there is actually a fracture, but there could be ligamentous injury, soft tissue injuries, but there's definitely swelling there that may need to be followed up later. So yeah, some displaced fragments, yeah, in that posterior aspect.